All right, good morning, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Way to Health. And today we're talking about fatty liver disease. We're going to talk about pancreatitis a little bit. I'm joined by my dear friend Kathy. Kathy's with us. Good morning, Kathy.
Good morning, everyone.
Good morning, good morning. And so, Kathy, last night you and I were talking about fatty liver, and maybe let's take us through some of your friends or experiences you've had with people talking about fatty liver, what they do, what they think is a good treatment, things of those nature.
Well, I do have a dear friend who's just been diagnosed with pancreatitis, and I think this is a weird thing, but I think maybe some of the folks out here will recognize this. Came upon this by having some other kind of pain, and went to the doctor. He was having some spasms. They're like, okay, well, we ran tests. They found something. They found like a tumor on his pancreas that's benign, but it gave them the window to start looking. And I guess they should have been looking closer, because when we talked last night, they told me that he'd had a pancreatic attack like 8 years ago.
Okay.
But we've gone through all this stuff, so they call me and say, what do we do for fatty liver? That's one of the side effects they told us we're dealing with. He has diabetes. He has, all sorts of health issues, but probably at the root of a lot of these is a weight type of situation. He's gained a lot of weight in these past years.
Okay.
He was disabled by his work, and so he spends a lot of time, not doing a lot. So eating sweets, especially when you're had been a healthy male and maybe you're depressed because you're sitting around,
right,
not working, and you're not active like you were. So you find yourself binging on all the things that you shouldn't: ice cream, pie, cake,
right,
cookies,
right,
all the high food groups that go along with depression. So
yeah.
in this area, then we started looking at what the doctors had said. I even called you and said, hey, what do you do for fatty liver? And so we thought, we hadn't touched upon this, but a lot of the things that cause a lot of the autoimmune things that we talk about.
True.
So why don't you give us a little indication, besides my experience, why else it's important for us to talk to these folks about pancreas and what goes on with pancreatitis and fatty liver, because this does seem to be kind of a go-together kind of thing.
Very much so, yeah. A lot of overlap. We're talking about it because we're kind of in a phase of discussing the liver. Last week we talked about autoimmune hepatitis. We'll probably be talking about autoimmune hepatitis a little bit more. It's just a deep subject, and I don't want to glance over these issues. Fatty liver most certainly fits into that, as well as pancreatitis, because fatty liver, pancreatitis, autoimmune hepatitis, it all relates back to our gut bacteria, like Kathy and I so often talk about. And maybe you feel like we're beating a dead horse, but we're going to keep beating it, because this is the genesis or the center of so many diseases affecting modern Americans. And it's totally diet related, as Kathy alluded to. Our mental state can heavily affect what we're eating. And I think we've all had some experience in that, where if we have a bad day or if we have a bad year, that we're gonna maybe binge and console ourselves with what we eat. Well, that and the changes in how our food is grown in this country, and just kind of the acceptance of what we eat and what we don't eat, seem to be facilitating these evil bacteria in our intestines that basically get entrenched and they're hard to get rid of. One of our analogies that we used to use on the radio show, think of a field overgrown with weeds. You can go in and mow down the weeds, but the weeds have a tendency to grow back up. And you can try to starve the weeds, you can put weed killer on them, and that can have some effect, but it's not the same as if that field had been planted with beautiful grass and the weeds have been plucked out, meticulously as the years went on. So that's kind of what we're dealing with, and that's why we're talking about fatty liver, because fatty liver is going up in incidence. Fatty liver is associated with this thing called non-alcoholic steatohepatitis, which is referred to as NASH. And it's kind of another step up in terms of the level of severity of the fatty deposition in the liver and inflammation, and can progress to some pretty significant fibrosis, which you would know as cirrhosis. And then we have pancreatitis. Pancreatitis also goes up when we have an increase in body mass. So its chances of happening go up as our body mass increases. And also with pancreatitis, pancreatitis can be associated with alcohol consumption acutely or chronically, and other factors like smoking and things of that nature. So that's why we're talking about all of this. And good morning to everybody who's coming on and saying hi. Just want to throw that out there. So Kathy, what were you thinking about that?
Well, I mean, if people are having some symptoms, what are the symptoms they would look for pancreatitis? I mean, it's not like, you know, we can wake up one morning and, oh, I think I have pancreatitis, because
right.
You don't know what the heck it entails.
Pancreatitis usually manifests with acute abdominal pain. And one of the cardinal features is significant abdominal distension. If you see a pancreatitis patient, you'll notice that like their stomach, oftentimes they'll feel like it feels like a basketball, or it will look like a basketball. So they're really distended. And the reason why pancreatitis can be life-threatening is because if the pancreas is releasing the digestive enzymes into the abdominal cavity, those digestive enzymes can literally break down our organs. So that's why pancreatitis is nothing to fool around with, especially, you know, if you think you have pancreatitis, you got to get to the hospital. It is an emergent condition. The most common cause of pancreatitis would be gallstones. So I probably should have drawn that anatomy up here, but in essence, your gallbladder releases bile, and the bile comes down and it has to go into this duct, which shares a pathway with the duct from the pancreas, and then it goes into your intestines. Well, if you spit out a gallstone, which then goes down the pipe, so to speak, and blocks the stuff coming out of the pancreas, then the digestive enzymes coming out of the pancreas get backed up into the pancreas and then can start to leak out. So that's why it's such an acute issue. You're going to have a lot of pain, most typically. You're going to have the swelling, and you need to go to the ER to get evaluated, because if you have a gallstone in there, it can be an emergency surgical situation. And even if it's not due to a gallstone, let's say it's associated with you're a diabetic and you haven't been taking your meds, or you drink a bunch of alcohol, you need to be in that medical care, or at least not eating at the very least, so you don't trigger further damage to the pancreas in your body. So that's kind of the story on that.
Okay, so if we're looking at how to treat pancreatitis, do we look solely at diet, or do we look at medicines or prescriptions or supplements? What do we look at?
With pancreatitis in the acute phase, it's all about figuring out what the cause is. So if the cause is the gallbladder, then most likely that stone's going to be resected, or your gallbladder is going to be taken out. If it is alcoholism in the acute phase, if you just went on a binge drinking spell, they're probably going to replace your fluids. They're going to give you some glucose. But lots of times the treatment is just palliative. They just kind of watch you. They make sure your blood sugars are stable, things of that nature. If it's diabetes related, they're going to control your diabetes with medications. If it's the chronic phase, the most common cause of chronic pancreatitis, at least that I've seen, is typically alcoholism as well. Smoking can be associated with it. So it's basically, Kathy, lifestyle factors. Unfortunately, what they've seen is that if somebody doesn't change their alcohol consumption, pancreatitis has a very high chance of coming back. So that's a big one as well. And I think you have experiences, Kathy, I have experiences with patients where when they do develop pancreatitis, let's say from something like diabetes, lots of times it wakes people up because it is so miserable, it is life-threatening, it's a significant condition, it has a high degree of just suffering associated with it. So lots of times that's the factor that causes diabetics to change their act and change what they're eating. So.
Well, I saw this friend last evening and spoke with them, and I had heard that he'd been going through this and had started losing weight, changed his diet, had stopped his alcohol consumption, and I hadn't seen him for probably 6 months. But the last I'd heard, he lost 16 pounds. So I looked at him and I said, "You've lost 20 now, haven't you?" And he's like, "Yeah, how'd you know?" And I said, "Well, I've done this my whole life. I know what 20 pounds looks like." but I also could really tell a difference in his skin tone, his eyes. And I mean, he's a big guy, but he was always a very active guy. So I mean, at the same time, I could see, and I think with diabetes, weight, all the things that he has going on, I'm sure there's hypertension. So I saw less redness in his face. All these things that work together when we're not eating right, we're doing all the wrong things.
Right.
But we're doing them for what we think are the right reasons.
Sure.
I mean, they aren't for us, but I think it's important for people to maybe sometimes take a personal inventory. If you're not feeling well, I mean, we always say the eyes are the windows to the soul, but there's so many times that if you look at a picture that you had 2 years ago and your eyes don't look like that anymore, your skin tone doesn't look like that anymore, and you're feeling bad, maybe it's time to start taking a look and saying, there may be something wrong here, because just that appearance of yourself is so telling, I think, when someone really isn't up to snuff, when there's something going on internally that they're not paying attention to, and they're either masking with alcohol, food, whatever that situation is, then we need to kind of, if we want to feel better, then it's time to take that personal inventory and start, give yourself a good look in the mirror, then give yourself that personal inventory. What am I eating? What am I drinking? Have I quit smoking? Am I not? Because whether it's pancreatitis or some of these other things that we talk about all the time, they seem to be so related. And I know you're going to tell me, yeah, then we need to look at the gut bacteria.
Right. Yeah.
So tell us about that.
Well, I just want to say you're so right on with that, Kathy. You're so right on, because I know my personal experience was so that I finally had an epiphany, seeing a picture of myself and seeing it compared to this kind of illustration when I was at a seminar, which prompted me to make positive changes in what I was doing. Okay, so we got the door closed. And so, yeah, we have to be realistic with ourselves. And I think most people who go through some sort of dietary change, especially the patients that I've worked with, you all know it. You know that when you see friends and loved ones that you haven't seen in a month or two, they tell you, "Wow, you look so great. Oh my gosh." And just like Kathy, I mean, I can usually predict how much somebody's lost within a couple pounds just by looking at them, and their skin tone will look completely different and things of that nature. So yeah, I think that's great advice. Now, so relative to Kathy's question, gut bacteria, how does this all work? You hear us talk about LPS a lot. What is LPS again? LPS stands for lipopolysaccharide. Lipopolysaccharides are pieces of gram-negative bacteria. So gram-negative bacteria is this one major grouping of bacteria. They have these little tails called LPS. It seems that when we're eating a high-fat, high-carbohydrate diet, like the standard American diet, many of you may be thinking, well, how's that the case? Well, a hamburger, a milkshake, and a fries is your classic example. And I know a lot of you may not eat that all the time, but maybe you're having pasta every night with a ribeye, something of that nature. That type of dietary pattern really facilitates the growth of these pieces of bacteria. And then these pieces of bacteria, because of our chronic food consumption, the way we consume it, leads to break off of these pieces of bacteria, and that's where a lot of dysfunctional physiology starts. Just pausing there, we can say these bacteria are associated with the diabetes process. It causes prediabetes, it causes diabetes. That has now been unequivocally shown in the literature. I can send you the research articles if you want. This LPS, as we were talking about last week, is highly associated with autoimmune hepatitis. Why do some people develop diabetes and other people develop autoimmune hepatitis and some people develop fatty liver? A lot of it is based on the severity of the issue and your genetics. Your genetics is really important too, and how your immune system recognizes excessive pieces of bacteria. Then The pieces of bacteria, the LPS, come in. They bind to these things called toll-like receptors. Particularly, you'll hear me talk about toll-like receptor 4. This is one that has an affinity for the LPS. Well, the LPS will also activate this thing called the LPS-induced TNF-alpha factor, which in essence is this enzyme that produces a bunch of TNF-alpha. What is TNF-alpha? TNF-alpha is an inflammatory chemical. If you watch the broadcast for drugs like Humira on